Hi everyone, hope you're doing well and happy Women Wednesday. Today we're going to be talking about the importance of peeing after sex and different experiences around peeing and not peeing after sex and just overall UTI or urinary tract infection health and just urinary tract health in general. But we'll give it a couple minutes for folks to get into the room, get into the space, and then get started. Welcome Whitman-Walker. We also have a fellow colleague of mine at Whitman-Walker, James. Excited to have her as part of the conversation. I hope everyone's doing well. If you are in need of HIV or STI testing, please contact Whitman-Walker Health at 202-797-4439. You can schedule an HIV testing appointment, HIV or STI testing appointment at their Max Robinson Central location in Anacostia or at their 1525 14th Street location on 14th Street Northwest. Hey, Ayala, how are you?
Hey, how are you? Good evening.
I'm good.
Great to see you as always.
A couple of minutes because I had my Bluetooth headphones connected. So, hi everyone again. Welcome to today's Instagram Live. We're going to be talking about UTI health and urinary tract health and just the importance of peeing after sex in general. Thanks so much for joining. We are joined by the lovely Ayele today, who will also be sharing the space to talk about experiences with peeing after sex and UTIs and just the importance of peeing after sex. But Ayele, do you want to introduce yourself?
Yes, thank you so much for having me. My name is Ayele. My pronouns are she, her, hers. And I'm the Community Health Education and Training Coordinator here at Whitman-Walker Health.
Awesome. Thanks so much for being here with us.
Happy.
19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health insurance. The community health team is here to educate and support you. Before we get started, if you are in need of HIV or STI testing, got the pinned comment below. You can call 202-797-4439 to schedule an HIV or STI testing appointment. Ayala, your audio is perfectly fine, but just heads up that your video is a little bit choppy, but we could hear you perfectly.
Oh, is it better now? It's still choppy now?
Still a bit choppy, but we can hear you perfectly.
Okay, all right. I'll try to see what may be causing that. Okay.
But cool. Thanks again for joining. My name is Jewel. I use groups pronouns, and I work to bring educational Instagram lives to the space with Whitman-Walker's community health team. And today we're going to be discussing the importance of peeing after sex. Ayala, why do you think it's important that people pee after sex? Sorry, y'all. Working through some technical difficulties. I think they're going to rejoin us in a second. But if you're listening in right now, feel free to drop in the chat why you think it's important to pee after sex. While we get them back in the room. I know that for me.
Thank you so much for re-adding me. Sorry about that. Is it better now?
No problem. It's still a little bit delayed, but again, the audio is perfect. So we can hear you.
Okay.
Before we redid the live and getting everyone on, I was wondering what you thought the importance of peeing after sex was.
Yes, I've always been told that it was to prevent infection and to make sure that your body clears everything that it needs to do. But I'm excited to talk a bit more about that with you today too. How about you? What have you heard and what do you feel about it?
Likewise to what you said, and I think that on my end, like the first time I ever heard about peeing after sex was in a women's health class in high school, and I feel like our teacher like emphasized it, but we only heard it that one day during the entire class. So I feel like they could have pushed a little bit more and given more reason as to why it was important to pee after sex, but they just were like, always pee after sex. If you're a lady, like always pee after sex, and like that's kind of where they left it at. And I was like, all right, like mentally noted, but
Never
not
know
enough to
why.
scare me into making and not that fear based, but like after experiencing it, I think I would like it for it to be fear based at some points. Um, but yeah, they didn't give enough of a why. So yeah, all of that.
So glad that we're going to be talking more about that why today.
Exactly. So before we get into the whys, here are just like a few basic anatomy things that we should go over to kind of help set the context, set the room, set the standard. So anatomy. The vagina or vaginal canal or front hole solely refers to the vaginal hole where babies can be delivered and where insertive sex happens. So the rest of the area is known as the vulva, which includes the inner and outer labia, vaginal lips or the minora and majora, the clitoris, the clitoral hood, the mons pubis, which is where the pubic hair and pubes are, and the urethra, where urine and pee comes from. Now, there's kind of a little bit of a debate that like I saw on social media last week, hence why we're talking about this week, but about the importance of peeing after sex. So I would say that it's so important to pee after sex because after sex or intercourse, you help to minimize your chance of getting a UTI by peeing. So UTIs are when bacteria gets into your urethra. It may cause painful or frequent urination. But by peeing after sex, you help to filter out any bacteria that might have creeped up into and around your urethra during sex. So if you're looking to leave this space today with like a few important tools, this is one of them. Definitely pee after sex. As I think within 30 minutes, like the golden standard. And if not, you might learn the hard way of why.
Why you should after sex. Yep. And so we can talk a little bit more about UTIs as well. So it's an infection that can occur in any area of the urinary system, in the bladder, the urethra, or kidneys. An infection of the urinary tract generally occurs when that bacteria that can get transmitted during sex gets into the urinary tract. And that enters through your urethra and starts multiplying in the bladder. If your natural defenses in your urinary tract fail, that bacteria can grow uncontrollably, causing an infection or a UTI. Peeing after sex helps to flush out or to clean out that bacteria out of the urethra, thereby helping to prevent a UTI. Especially helpful. This is especially helpful for those with vaginas or front holes who are more prone to these UTIs. And so those who have vaginas are more prone for UTIs, and they're more common in cisgender women and people who are assigned female at birth. And this is due to the anatomy. The urethras in the female anatomy are shorter than in male, than in male anatomy, so they are 2.5 to 4 centimeters. Otherwise, while in those with those with penises are about 15 to 20 centimeters. This reduces the distance that bacteria has to travel to enter the bladder and cause a UTI, making it much easier for bacteria to flourish and grow and live their best lives, which is not for the best for us.
Yeah, our lives are they're living their best life.
Yeah, they're living their best lives. Other factors that can increase the risk are forms of birth control. People who use diaphragms or any sort of spermicidal agents for birth control have an increased risk of UTI, likely because they're actively touching the vagina or front hole and urethra area in order to use these forms of birth control. It to more bacteria.
You're out a little bit now.
Oh, the audio is going out?
Okay, I think it's back, but it did for a second. So
It's back?
So basically, if you're using diaphragms or spermicide because you keep touching your front hole or your vagina or what have you, like you're putting yourself at more risk for bacteria, and that might be what causes a UTI. So just heads up there.
Absolutely. Yep. So continue to wash your hands, especially if using one of those forms of birth control, to reduce the amount of bacteria that you're introducing to the area. Another risk factor for UTIs is sexual activity. The risk for UTIs is greater in those who are sexually sexually active than those who are not, and the risk is also even higher if there are new or multiple partners. Another risk factor is menopause. Because the reduced levels of estrogen after menopause causes changes in the urinary system, making you more prone for infection as well.
Thank you. Really helpful to know. And so I guess it's also important to know what to look out for if you were, new to UTIs, didn't know what they look like if you were to get one for the first time. So some of the signs and symptoms include a sudden urge to pee, increased urinary frequency. So like you might be having to pee a lot, but you're only passing a little bit of pee each time. It could also be cloudy or smelly urine. You might also see blood in your urine. It might be painful in your lower abdomen. You might just feel generally unwell or sick or tired. You might also notice some behavioral changes such as agitation or severe confusion, especially in elderly patients or elderly individuals who are experiencing a UTI. You might also experience rectal pain. This is more common in men and folks who were assigned male at birth. And you may also experience some pain in your upper back and abdominal sides. This may be a sign that the infection or your UTI or urinary tract infection has spread to your kidneys. So alongside that kind of pain, you may also experience nausea, vomiting, chills, and fever. But yeah, those are some of the things to look out for in terms of UTI symptoms.
And when we talked a bit about one of the ways that can cause these symptoms of causing the UTI of being through sexual contact or through the birth control options that can increase the risk as well. But there are some other things that to look out for that could cause it as well. So looking out for things like problems while emptying your bladder while urinating. Blockages or obstructions in the urinary tract, like kidney stones or an enlarged prostate, can have an effect as well. The use of urinary catheters, frequent use of antibiotics, can also disrupt the balance of bacteria in the urinary tract as well.
Ayeli, have you personally ever experienced a UTI?
One time, and it was the worst. The worst 3 days of my life. Thankfully, I already had a GYN appointment scheduled for that week, but I just remember feeling so uncomfortable. How about you?
Look at the higher ups working. They already had that appointment on the books. Like that's
yeah, come on.
It can take a long time to get an appointment with any doctor, but an appointment with your GYN especially, it feels. I have also experienced one. I've experienced more than one, but the first one is the most memorable. And, all of the things that we listed, or many of them, like I was having a sudden urge to pee. I was peeing a lot. I feel like I was going at least 2 times every 30 minutes, so like 4 times an hour at minimum. I was out of state, so I wasn't like by my local doctor at the time, but thank God my mom's worked in insurance her whole life, so we had like really great insurance. I could just find a doctor and see one who was around where I was. But I didn't know what was happening to me. It was my first one. I didn't know what to do. I just was super confused. I was like dating someone who was in the medical field at the time. And I was like, you have to bring a catheter home for me. Like I'm ready.
Bring a catheter home.
Like I can't have to go to the bathroom and pee and only have like an inch of pee come out of me again. Like it's just not like I was feeling the behavioral agitation. I was feeling all of the just all of the irritation that comes with the frustration of having to pee but not having to pee at all. So yeah, I wouldn't wish it on my worst enemy. I want everyone after sex. I want you to not have to go through what that first one felt like.
Let's create a UTI free world.
Exactly.
Right. And while we're talking about how we got treatment when in our experiences, but if you do have some symptoms, always remember to visit your physician if you do have symptoms or signs that Jules so wonderfully shared of a UTI. They may prescribe antibiotics to treat them. And the UTI symptoms days, and make sure to complete the entire course of the medicine, even if the symptoms improve, just to make sure that the infection is cleared.
Yeah, and if you aren't able to get that treatment, and that'll help clear you up in 5 days or so, I think some of the things that offer some relief are things like AZO. You'll see it in the like women's health or, people with vaginas and front holes aisle in a CVS or a Walgreens. I think people have said that relieved them. I know that helped me while I was waiting to get that prescription filled. Other folks like cranberry juice, but try to get the real stuff that's like super tart and sour versus the sugary like ocean spray stuff, because sugar will only cause you to probably have to pee a little bit more. But healthline.com shares the following steps you can take to decrease the risk of developing a urinary tract infection and help you prevent yourself from getting one in the future. So you want to drink a lot of fluids, especially water, as this helps to dilute your urine and ensures that you pee more frequently and helps flush out bacteria from your urinary tract. Again, drink cranberry juice. There's no conclusive study that exists that proves that drinking cranberry juice can prevent the occurrence of a UTI, but some people swear by it. I know that after I had my first bout of UTI experiences with an S, I started drinking or keeping that super tart cranberry juice in my fridge at all times. I also, healthline.com also suggests that you pee after sex. I also suggest you pee after sex. Peeing after intercourse may help flush out the bacteria from your bladder. So again, for those of us who have shorter urethras, that's super important because that bacteria only has to travel so far, only a couple centimeters, to ruin our lives for the next 3 to 5 days. You also want to wipe from front to back after using the bathroom. So this will help prevent bacteria from the anus from spreading to the urethra or the vagina and front hole. That's another key thing to leave here today, like pee after sex, and also always wipe from front to back. You want to avoid using feminine hygiene quotes products such as deodorant sprays or powders or douches in your genital area, as they're probably going to irritate your urethra. So any of that like douche stuff, any of that like you should smell like a flower and like wood and meadows stuff, like do not buy that. Don't put it on your private parts. It should not be on the shelves. And the fact that people still are in business for it today is wild. Also consider changing your method of birth control. Using diaphragms or condoms with spermicidal agents can lead to the growth of bacteria, so just be on the lookout for that. And also having sex with a full bladder also increases your chances of developing stress urinary incontinence. So this condition developed because of a weak pelvic floor or weak pelvic floor muscles or just a weak urethral sphincter. So in this condition, the bladder can leak during any movement that puts pressure on it. And this includes things like coughing or exercising or sneezing or having sex. So if you don't want to wet yourself periodically throughout the day, be careful to not, keep your bladder too full and then like put pressure on it. It just won't be a pretty experience.
So pee before and after sex.
Yeah. And then also I have a friend who is a urologist now, and she swears by it and says that everyone should be after sex. So if you didn't believe us here today, believe someone who's a doctor and a urologist at that. Ayeli, are you there? My video is spinning for you. I think it's frozen. All right. Well, before we go, thanks so much everyone for like learning a little bit more about urinary tract infections and peeing after sex and just the importance of it. Please, if you need to get access to an HIV or STI testing appointment, you can call Whitman-Walker at 202-797-4439 to schedule a testing appointment. And just be sure to check the website at www.whitman-walker.org/testing for the latest hours of information. Hey, Ayeli, you back?
Yes, sorry, I got kicked out. And yes, so whitman-walker.org. You can also call 202-797-4439 to schedule a testing appointment. And also feel free to you should call ahead for an appointment. They're by appointment only at both of our locations, the Max Robinson Center, 2301 Martin Luther King Jr. Avenue, Southeast in Acacia, by the Big Chair, if you're familiar with the area. And then we have a location in Northwest on 14th Street, 1525 14th Street, very close to Logan Circle. And if your community or organization is interested in Whitman-Walker providing mobile health services in your neighborhood, contact Mobile Health at whitman-walker.org and access HIV prevention tools like PrEP and PEP or starting treatment for HIV at Whitman-Walker Health, at the Max Robinson Center, or at the 1525 14th Street location. Thank you so much for taking the time to join us today to talk about the very importance of peeing before and after sex. So please continue to tune in to our lives and continue for the information on where to get tested, how to prevent HIV, and how to support the fight against HIV as well. Thank you so much for joining us.
Thank you. And of course, because we're in multiple pandemics at once, we want to talk about COVID-19 and vaccines.
Yep.
Already vaccinated, thank you so much. You've taken a really important step towards keeping yourself and your loved ones and your community healthy. Multiple variants continue to soar around the world, so it's understandable why you might want to keep wearing your mask, especially as we are now in these super cold months and are going to be gathering more inside and indoors and in close space with each other. Is not 100% effective at preventing the COVID-19, but it is very effective at making sure you don't get super sick with COVID, that you don't end up in the hospital with COVID, and that you don't end up dying from COVID-related complications. So all in all, please stay alert. If you haven't been vaccinated and you want to get vaccinated, please call Whitman-Walker at 202-207-2480. They've got COVID-19 vaccines available. And if they're just not accessible for you location wise and you're a DC resident, you can call 1-855-363-0333 or visit vaccine.dc.gov. If you're in Maryland, you can call 1-855-634-6829 or visit covidlink.maryland.gov. And if you're a Virginia resident, you can call 1-877-829-4682 or visit vaccinated.gov. And if you haven't been vaccinated and you don't want to get vaccinated, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's super important that you consider getting the vaccine, discuss COVID precautionary measures with those who are around you, but especially you want to be mindful of masks and keeping your distance with folks who you don't know if they've been vaccinated or not.
Yeah, and again, we're also tackling multiple pandemics as a society. So also, so according to the CDC, there have been thousands of cases of monkeypox documented in the U.S. In the DC, you can register for a monkeypox or mpox vaccine at preventmonkeypox.dc.org. And Virginia is working with local care providers to contact trace and identify those in most need of the vaccine. And for Maryland, has just released a pre-registration system as well. But please get in contact with your local health department, and we have updated information on both of those, or all three of those, on the Whitman-Walker.org website. In DC specifically, we have monkeypox vaccination sites at 3640 Martin Luther King Jr. Avenue Southeast in Ward 8, at 5335 Wisconsin Avenue Northwest in Ward 3, and at 926 F Street Northwest in Ward 2. These walk-up vaccinations are at a first-come, first-served basis to eligible residents, and hours may vary by location. But those hours as well are at preventmonkeypox.dc.gov. You are eligible to be vaccinated in DC if you are a DC resident over 18 years of age, and of any sexual orientation or gender, with confirmation of a utility bill or any other mail with your name and DC address, and a current DC lease or mortgage with your name on it. Please remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and checking our website, www.whitman-walker.org, for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. And follow the rest of our Whitman-Walker Health family at this page I'm live from now, at Real Talk DC, and at No Filter DC.
Awesome.
Thank you so much. Hope you have a wonderful evening, and thank you everyone for joining.
You too. Likewise. Bye.